This is Karen Tran's head-to-toe assessment video for Miss Walton's class. I am going to don and doff my PPE, but I'm going to keep it off for the head-to-toe assessment on my patient just because my laptop, I've learned, does not pick up very good audio if I have the mask on. So I'm going to go ahead and start with that. We gown myself first, tie it at the neck, and then move down to tie at my waist, gently, because these are not sets we get extras of at school. And then I would put my KN95 mask on, and then my surgical mask, and then I have a face shield. You could also use a pair of goggles, and then gloves, which don't have to be sterile, just clean. And then to doff, I would have someone help me in the back if they're available to untie the gown. Gently remove the gloves with the gown, throw it into the receptacle, and then I would remove my shield and then both of my face masks and then proceed to wash my hands. So I'm going to go ahead and pick my gloves back up so I can use those during my exam. Okay, or my assessment. Okay. All right, and then I'm going to turn the camera. This is my patient, my husband. He's already in character for the night. Okay, all right.
Hello.
Hi, how are we doing?
Good.
Good, I'm Karen. I'm going to be your nurse today. I'm just going to wash my hands. We doing all right today?
Yes.
Good. Okay, I'm going to be performing your head-to-toe assessment today. It's probably going to take about 20 minutes. We're going to check your vitals and a couple of other things just to make sure everything is in line with where it needs to be. And first, I'm going to check your orders over here. And could you tell me your name and date of birth, please?
Gao Tran. June 30th, 1985.
Okay, and can you tell me where you are today, Mr. Tran?
In a hospital.
Do you know which one?
No.
Okay, you're at Hospital Day Tran.
Oh.
Okay.
Okay.
Alrighty. Okay, so looking at your chart, do you have any allergies to medications, food, latex, tape, environmental?
No.
Okay. I'm looking at your chart and I can agree with that. It looks like everything here checks out. So we're going to go ahead and check your vital signs first. But before we begin, I want to ask if you're experiencing, on a scale of 0 to 10, any pain.
0.
0? Okay, that's good. All right. Well, let me go ahead. We are going to check your pulse oximeter. Could I have your pointer finger, please? While I'm doing this, I wouldn't say this to an actual patient. Let's see here. 94%, that's perfect.
I know.
94% pulse ox. I wouldn't say this to a real patient, but I would be watching his chest respirations and counting while I'm doing this without drawing attention to it. And do you know what your typical blood pressure reading is, Mr. Tran? No? Okay. That's all right. We're going to check for you today. All right. If you could, I just need you to slightly lift up your left arm. Perfect. All right. If you just want to relax. The normal blood pressure reading is usually 120 systolic over 80 diastolic, so we're just going to kind of see where you range since you don't know what your norm is. Okay. All right, you're going to feel a little bit of pressure, and that's normal, okay? You okay?
Yes.
You'll feel a little bit of pressure being released as we go. looks like your range today is between it's about 140 over 65. Sorry about that. Let me go ahead. I'm going to check your temperature here. Perfect, 98.9. And it looks like you don't have any signs of distress. From what I can tell, your body is symmetrical. All right. And you're not on any oxygen. You don't have any IV lines hooked up to you. You don't have a catheter. Everything is checking out with doctor's orders as they would be. We would definitely check on those things for you if you had them. And I'm going to go ahead and check your hair, skin, and your nails. We're just going to inspect your skin, your hair, make sure there's nothing on your scalp, and then we're going to check your nails. Okay? Okay, so let me go ahead and make sure there's no rashes, lesions, no breakdowns. Everything looks good. Right, if you don't mind leaning forward just a little bit so I can check your hair and your scalp. Everything feels good. Okay. All right, I'm going to go ahead and check your skin turgor just to see if there's elasticity that goes back. And a good place to check that is here, and sometimes on the top of your hand. If you were having issues, if it stays up, we've got an issue. But with it filling back up, that's where we want you to be. So that's a really good thing. All right, and then I'm going to go ahead and check your capillary refills. When we press the top of your nail, you'll notice that it turns white, and then it'll refill with blood. If you had nail polish on, we wouldn't be able to see that, obviously, so we could turn your hand over this way, and you would still see the same reaction. So your color returns almost instantly, so that's a good sign. All right. Okay, and you don't have any wounds. There's no drainage or dressing, nothing that we need to check on for that. So I'm going to go ahead and check your ears and your eyes. And this ear. Sorry. And I'm going to go ahead and turn on my pen light. All I'm going to do is just ask you to look forward, and I'm going to come across your peripheral, okay? I'm looking for your pupils being equally reactive. Yeah, you have pretty eyes. Okay. All right. And can you just follow my finger? Okay. Okay, we're going to check your mucous membranes as well. So actually, let me go ahead and thank you. Just check your nose, for your mucous membranes. Can you open your mouth and say, ah? Looks like you have excellent hydration. No lesions, normal color. Yeah. Okay. Right. And if you could, I'm just going to check your facial symmetry, which I wouldn't tell a patient. Could you smile? Beautiful smile, Mr. Tran. Thank you. Okay, and when you breathe, are you having any chest pain, regular breathing, or any chest pain when you have a cough?
No.
No? Okay. All right. I am going to go ahead and just inspect your muscle work and listen to your breathing. Okay, so if you could just sit up a little bit for me, Mr. Tran. I'm going to go ahead and just oscillate. Okay, so you need to sit up a little straighter. I'm going to listen to the front, and then I'm going to listen to the back. We're going to listen in a zigzag pattern, okay? Could you breathe in for me, please? With your mouth? Don't hold it. Breathe. Okay. Breathe in. Very good. Okay. One more. All right, perfect. I'm going to go ahead and listen on the back if you don't mind leaning forward for me just a little bit, just comfortably. All right, go ahead and breathe in. Okay, a little lower, one more time. And one last time for me. Okay, perfect. Thank you, Mr. Tran. Yep, I didn't hear any, there's no gurgles, no crackles, everything sounds clear. Right, and if there were any problems, I would teach a patient how to use an incentive spirometer and have them demonstrate the use, but that's not the case for Mr. Tran. Okay, and then now at this point, I'm going to ask if you have any chest pains.
No.
Okay, I'm going to go ahead and listen to your heart. I'm going to check in a couple different places, but I am going to check at the 5th intercostal space, which is 1, 2, 3, 4, 5, right there where the exit is. Okay. Right. And while he's doing this, I did earlier check his respirations, but I'm going to be doing that again while I'm not verbalizing that that's what I'm doing. Okay, go ahead and sit up for me, Mr. Tran, so we can check the back. Actually, I'm sorry, we don't need to check the back. My mistake. Be comfortable. All right. Actually, let me go ahead and check that one more time. I need to count your pulse rate. I'm going to start right here. I'm going to count for 30 seconds, okay? And then we'll multiply by 2. I've got about 62 beats per minute, so that's good. Normal is in the 60 to 100 beats per minute range, so you're right where you need to be. Okay, and I'm going to go ahead and lie you down, so if you don't mind just leaning forward a little bit, I'll make these pillows a little less supportive for you. We'll check a couple other things. Oops. Pardon my reach. Okay, go ahead and scoot down a little bit so I can check your tummy. All right, so this position on your back is called supine. So easy for me to remember because it's like spine, but a U in the middle. Okay, so do you have any pain, nausea, vomiting, diarrhea, any diet or dietary restrictions?
No.
Okay, when was your last bowel movement?
1 o'clock.
Today?
Yes.
Okay, is that normal for you?
Oh, yeah.
Okay. Perfect. Okay. I'm just going to inspect the shape, size, and symmetry and skin condition of your stomach. Just palpate a little bit. And then I'm going to listen to some sounds of your digestive tract, okay? And I'm just going to listen to all 4 of your quadrants. And then if I don't hear normal sound, I'm going to go ahead and listen to each quadrant for 5 minutes, but we should be okay. Okay? You okay?
Yes.
You have some good gurgle sounds, so it doesn't sound like there's a blockage. With a real patient, I would have raised the bed, so I wouldn't be bending over with my hand resting on the bed. Oh, you had a little squeak there. I would monitor any intake or output if we were measuring any kind of urine or anything like that. So I'm going to go ahead and move down to your extremities. Do you have any numbness or tingling in your lower extremities, your legs, your toes, your feet?
No.
Okay, that's good. All right, I'm going to go ahead and listen. I'm going to palpate for the pulses in your radial and pedal pulses and check your, your capillary refills in your toes just like we did in your fingers. I'm just going to check your capillary refills here on this toe. A good color return. Now I'm going to listen to your pulse. Okay. Color fill looks good on that foot as well. Okay. All right. So that completes your head to toe assessment, Mr. Tran. I'm going to go ahead and run your feet were a little cold, so I'm going to go and get you a warm blanket. Would you like some water?
Yes, please.
Okay, here, I'm going to go ahead and give you I'm going to put your call button right here in case you need anything, but I'll be back in just a couple of minutes for you. Okay.
Okay.
Would you like to leave the bed down for you to rest, or would you like me to put it back up?
I'm good.
You're good? Okay, I'm going to go ahead and pull the bed rails back up for your safety. I don't want you to fall out. All right, is there anything else I can do for you?
No.
All right, Mr. Tran, I will be right back with a warm blanket and some water for you. I'm going to go ahead and leave and wash my hands, but I'll be right back, okay?
Okay.
All right.